Well, here we are back with Dr. Tural. Dr. Tural, you are working with children, being a children doctor. Tell me, what do you think is one of the most important things, if there is such a thing, or there are two or three most important things which a mom, dad, parents anyway, should be, taken care of and be aware of in terms of like with the child at home? What kind of like education attitude, or what should they do with the child to make sure that the child has as good of a chance of being healthy as it can?
Those efforts start almost at birth. What you do to stimulate the infant has a lot of implications in the future. As they grow, of course, the role becomes from sole provider at the beginning to a guidance counselor later on. As a newborn and infant, since they cannot do too many things, you have to respond to their cry and what have you. And then later on, of course, you have to make the environment safe for them to explore. And then after that, it becomes like the food choices around that time becomes very important. You were mentioning earlier that broccoli is a good alternative to donuts. That starts around when they are young infants. What they take in their mouth, what parents offer them, sticks for a lifetime. And then, so education is starting when they are really young infants, and then it shapes up like when you read to your child on a regular basis as a newborn and an infant, they start liking reading, and then they find pleasure in learning through reading. And then, so all those things start early on and shapes up as they grow older. And then if you are not well prepared as a parent early on, you would blame things on the environment or other things, but the choices you make for the infant early on has some implication, if not a lot. So with that, parents have to tirelessly seek knowledge. And it is nowadays readily available through internet and other media. And then they always have these visits that they can use to their advantage to get good quality information from their doctors during their visits. Sometimes, of course, a critical question or two would provide them a guidance that they would need to going forward for the until the next visit that they come to the doctor. So,
what about Dr. Tural, what about the parents who don't quite know what question to ask? What would you, give me two or three questions, which maybe parents should ask, but they never do ask. Two or three major, misconceptions or major problems which parents think they do and they don't even know they do it.
Right. Yeah, as I mentioned earlier, some of the parents do like to surprise their young infants with tastes of this or that, which could be a donut taste or could be a little candy or other things that are rather not right to try at an early age. And then they do those things, and then they do not realize that they are setting up the stage for some bad choices for the child to make in the future. What they can ask is to give parents credit. Some of them are like trying hard to be a good parent, and some others lost in the struggle of survival. And then so we have all sorts of parents, and then of course if one's troubles are to make the ends meet, of course that person would not seek out the best that they can deliver for the child because simply they have more on their agenda. So, but preparation for an office visit, for a well child visit, does involve how to help the child to gain a greater developmental milestone. And then it would go towards language acquisition and fine motor skill development, gross motor skill, and how to stimulate those skills in an infant. And then also it goes into good nutrition. And then also it does involve inquiring about what those vaccines are that we are trying to do and what are the implications, long-term implications. We as pediatricians, we shape the landscape for germs in the population at large. We do by controlling childhood diseases and infections, by successful immunizations, we do control the adult population's germ population, and then how they affect the grown-ups. So we do have a sort of important role there, and then if they are sort of willing to be a part of it, then they would keep their well child checkups, and then they would learn about immunizations from reliable sources. I understand there's a lot of immunization bashing that goes towards a bunch of people being against it. But those people do enjoy the immunization rates that would actually protect them from infections. If everybody else is immunized, their child would be protected because nobody else around them could have that infection. So that way they get sort of free ride, if you will, even though they are against immunizations.
I see. So basically, it's easy to be protesting against a particular thing and say, it has side effects which here and there might not be true, but like the reason those people now not getting sick is because the rest of the people are so protected.
Right.
And so it's easy to say, see, I'm not getting sick and I don't do it. That's because nobody else is running around infecting you because we immunize them. I got it. Well, look, I appreciate your candidness about it. Very informative, and we'll have more conversations on many of those topics. Thank you very much, Dr. Tural.
Thank you, Mr. Flash.